I'm Jerry Antimano. I'm Senior Manager for Community Development at HITLAB. And I've got the distinct pleasure today to interview Samah Ragab from Organon. Really nice to meet you, Samah. If you could just let the audience know who you are, what you do, and most importantly in this virtual world, where you're calling from as well.
Okay, thank you so much, Jerry, Stain, and all of that team for the opportunity to be with you today. It's not the first time, but as an attendee, but it's the first time as a speaker. So thank you for the opportunity. I'm Samah Ragab. I'm heading the Middle East Regulatory Affairs organization in Organon. Organon is the a pharma company, a multinational pharma company that mainly work in women health. We are working on the women health from wider perspective, including more than the reproductive health. We are looking at more diseases that impact women, maybe in a different way or disproportionately. I'm calling from Dubai, where I live, my family, and we have our headquarter of Middle East, North Africa, and Turkey region office, Organon office here in UAE. This is it.
Wonderful. No, thanks so much for joining us. We appreciate that it is a little bit later on that side of the world, but I'm sure you've got much better weather than we're experiencing over here in New York at the moment. So very jealous that you got a bit of a warmer climate over there. But we're here to sort of talk about sort of bridging the women's data gap that you're sort of focused on at the moment. We hear a lot about the political gaps and the financial gaps in the news all the time, but we'd love for you to shed some light on the current gender data gap and why it's important to bridge that at the moment.
Yeah. So nowadays, as you know, data plays a crucial role in facilitating and informed decision making in public health, and to ensure the ongoing scientific progress in healthcare. Also, to achieve universal health coverage and the health SDGs, it's crucial also to have strong and dependable data to rely on. Disaggregated gender data that is mainly based on gender is crucially needed to empower health systems to uncover disparities, to conduct a comprehensive gender analysis, to reveal gender inequality and constructive gender norms, so it's able to improve access of healthcare to women and other vulnerable groups. Also, to tailor policies to be gender responsive and transformative. Allocate resources appropriately to enhance capacity and to establish fair and inclusive health system. And the World Health Organization in 2019, they actually took a significant step to disaggregate their global health statistics by sex. This was done for the first time, and this was a great step, breaking down the individual data at all statistics of the World Health Organization to disaggregated by sex. For decades, the women health used to be also narrowly perceived, focusing on specific anatomical parts of the woman body, but main conditions that might impact women differently, or that might impact women disproportionately, were totally excluded. Also, women were excluded from clinical research and clinical trial until 1993. So all the data that we have for now are really biased against women, because the available data worldwide infrastructure, where for long time, based on trials and research that mainly including only men. But let me say that this is hugely improved recently in the recent years. However, it's not enough. And even clinical trials that are inclusive, more inclusive to women, they do not disaggregate data. Some of them, they are not disaggregate data based on gender. So that's why we have this kind of gender gap. And it's important, as we said, to have this aggregated gender data to be able to reach better health for women.
No, absolutely. Yeah, no, you brought up some really fantastic points there as to, really shedding a lot of light on the importance of why that needs to be bridged at the moment. And there, as you mentioned, there have been some improvements, but we're definitely not done yet in terms of really making sure that that gap is bridged. And to that effect, you mentioned a little bit about some of the biases that are involved, with bridging that data gap. Can you talk a little bit about the key challenges that you've seen and that you've read on around collecting and using data related to women's health issues at Organon?
Yeah, sure. So to have effective and accurate data sets, you have to have a clear definition. And without a precise definition to women health, comprehensive definition that takes into consideration not only the reproductive health as we used to do historically, but also to take into consideration diseases that impact women differently, or diseases that impact women disproportionately. And one important examples of kind of diseases that impact women differently is the cardiovascular diseases. And if we have like an in-depth look at this example, we will find a shocking facts actually. While third of all these deaths from heart attacks are among women, women often exhibit atypical symptoms, not same as the symptoms that we all know about heart attack. So this resulted in that 37% of women are 37% more likely to receive an incorrect initial diagnosis when presenting to the emergency room with heart attack. And women under 55 of age are approximately 7 times more likely than men to be discharged without hospitalization when presenting to the emergency department with an heart attack. So as you can see, it's very important to have an accurate definition, comprehensive definition, to be able to get accurate data and effective data. Another significant challenge, I would say, funding, because inadequate funding is in all women research is really a big challenge, and the global statistics highlights the underfunding of all women health research, and generally and across the entire data value chain. And if we take an example of the biopharma, you will find only 4% of all biopharma research and development spending is directed towards female-specific conditions. So generally, this underfunding for women health research that generates specific data about women is really a fundamental challenge, and we need to work on as all stakeholders in the working in health and pharma. I can see also another examples to demonstrate this lack of funding in women health. We can see it everywhere and all over the board.
Yeah, no, absolutely. I think you bring up some really, important challenges and need some shedding light on, and we got a lot of agreement in the audience. I think you saw some of the audience virtually applauding, and some of the heart emojis come up in total agreement with you around some of the challenges that that both the physicians and the patients are facing at the moment. And hearing that sort of statistic about misdiagnoses, does definitely resonate with me. Having a mother that's had several bouts of proper diagnoses with regards to her cardio or her heart health and stuff. So really, really important points there, Samah. Are there any notable tools or tech that you've seen that are being used to enhance that sort of data collection at the minute, and that are being used in analysis within this sort of context?
So we are in a digital health symposium, so we cannot ignore how much digital ongoing innovations are playing an important role in this. And actually, when we talk about digital health, we can see the role of big data technologies, fairness algorithm in AI models to better process data in conditions that impact women, and manage the historical biases in the data. So lots can be done with the digital tools, but what we need to do is this collaborative approach, this collaborative efforts from all stakeholders to work on this and find innovative solutions using digital tools, because they are offering a lot.
Yeah, no, absolutely. We've seen a lot of these tools being used and being developed. Those of you in our audience who are familiar with the Women's Health Tech Challenge, we are planning to hold it again at the beginning of 2024. So do keep an eye out for that. There's always a wonderful plethora of different tools that are being developed for women's health tech that we are shining a spotlight on. So do keep an eye out on that. And of course, you guys at Organon, constantly, working to seek that kind of tech that's going to be making that difference for women's health on a global scale. As we sort of close now, Samah, we're always very limited in the conversations that we have at this particular event. But in closing, can you talk about how businesses and corporations at the moment can contribute to bridging that gender data gap that you're talking about, both within their organizations and in their industries as a whole, and maybe share some success stories or best practices that you've seen in different regions of the world?
Yeah, sure. We talked about the unified universal definition and how it's important to develop one. And this will bring opportunities throughout the data value chain for life sciences companies, providers, payers, academics, all stakeholders. So we're all, we need all to align on a universal definition. And in Organon, as I mentioned before, we have already adopted a comprehensive approach, and this is how we also build our pipeline based on this universal approach to women health and women health conditions. Also, we need to work, maybe corporates should do more and fund more innovative ideas and solutions. And I got along a lot of initiatives from big pharma companies to fund the startups that are working on data solutions, to empower new innovations in data solutions. And in Organon, if you are talking about success stories, we have in Organon Minat, we already launched a Femtech Accelerator program where we are sponsoring startups that work in Femtech solutions, including these startups that are working on data and women health data. Also, we have like a collaboration with UNFPA. This is the United Nations Sexual and Reproductive Health Agency that work on reproductive health, and this collaboration has one big pillar that includes enhancing the digital knowledge and data solutions with ethical artificial intelligence capabilities, as well to provide information and analytics. And finally, diversifying clinical trials. Not only diversifying clinical trials, but also work to disaggregate and analyze gender-specific data in these clinical trials and other women health research.